an accident. He spent most of his savings on medical care and worries he won't have enough to pay for help with everyday activities like getting ready for work so he can lead the life he wants to lead. He has family in his life, but they have their own kids to take care of. He is a young man that enjoys his independence. Long-term care can overwhelm a family's finances. Let's consider these examples. Hakeem turned 50 last year, and after caring for his mom, he realized he needs long-term care insurance but can't afford it. It would cost him $2,700 a year. It's important to realize that private long-term care insurance is the current way that we pay for long-term care, that together with Medicaid. Most people can't afford it. 93% of Washingtonians can't afford long-term care insurance. The average premium nationwide is $2,700 a year. Sometimes people are quoted prices lower than that when they're younger, but the premiums tend to go up as you get older. And that's the average currently nationwide. And it's important to keep in mind that the private long-term care insurance premiums are something that you pay not only while you're working, but throughout retirement until you die or need care. With the Walk Cares Fund, you only pay the premium while you're working. If you are unemployed, if you get laid off, you don't owe a premium. If you take time out of the workforce to raise a child, you don't owe a premium. You only owe it when you can afford it. You only owe it while you're working. And when you retire, you stop owing a premium as well. So if you're 50 years old and you're looking at the cost of the Walk Cares Fund compared to private insurance, keep in mind that you only owe your Walk Cares premium for 15 years if you're 50 till you're 65 roughly, until you retire. And for private insurance, you might owe that premium for 35 years, so more than twice as long. If you're 50 years old today, you might owe it till you're 85. So, and if you drop it at any point in time in retirement because you can't afford it any longer, then you'd lose the coverage and you have paid in for 20 or 30 years for nothing. So these are all reasons why the Walk Cares Fund was introduced, because it's a more affordable way to pay for long-term care in a way that is sustainable for individuals as they get older. Another important thing to keep in mind is that the need for long-term care not only affects us individually, it also affects our families. It has a ripple effect across families. So when I'm older, if I need long-term care, maybe if I haven't planned ahead and I didn't participate in the Walk Cares Fund and I don't have this protection in place, then I'm counting on the fact that my wife will quit her job and care for me, or if she's already retired and maybe she dies before I do, maybe I'm on my own, I'm counting on the fact that my son or daughter will quit their job and take care of me, or move across the state, or maybe even move across the country, or even across the world if I have family somewhere else, to take care of me. When my mom needed long-term care, my siblings and I didn't live in the same town as she did. And we would have to travel many times we traveled there to take care of her and take turns caring for her. This is the situation that families find themselves in. When an older adult or any family member needs long-term care, it affects the family as a whole, not just that one individual. And oftentimes the children who take care of their parents may end up having to either step out of their career, leave the workforce to care for a parent, or move. Like I had a colleague who had to move across the state to care for her father, and she couldn't get back into her previous career. She had to change careers and start back at the bottom. That happens to many people who care for their loved ones. So why does the state need a new approach to long-term care? Well, the issues that I've just been talking about that all families face are now starting to affect the state as a whole. And this is because of the aging of the population. And this is a phenomenon that's hitting the entire world, not just the United States. In Washington state, over the next 15 years, the population 85 or older is going to double. And the population of people 75 to 84 is also going to double over the next 20 years. And so a problem that used to just be a problem for families is now becoming a problem for the economy and for the budget. So for the economy, this means that before the Walk Cares Fund, before this new protection was in place, what would happen? Many firms would lose some of their best employees, typically women in the prime of their careers in their 40s and 50s, might have to quit their job or turn down a promotion, not take on additional responsibility because they had to care maybe not only for children, but also for an older adult who needed care. And for that hurts GDP. It hurts the state's job growth. It hurts our economy. It also affects state budgets. So with the doubling of the population 85 or older, you're going to see the share of the budget that goes to long-term care increase. So currently 6.3% of the budget goes to long-term care. Without the Walk Cares Fund, that could double with the doubling of the population 85 or older in the coming 15 years. And so without the Walk Cares Fund, taxes would have to go up. Sales taxes and other taxes would have to go up to pay for the long-term care costs associated with the age wave. Clearly, that wouldn't be sustainable. So these are some of the reasons, both to protect families and to protect the employers and to protect the economy, why the Walk Cares Fund was introduced. So what is the Walk Cares Fund? It's a universal program, kind of like Medicare, where everyone pays in and everyone can benefit. It's an earned benefit. Only people who've paid in are eligible. It's not welfare. It's not subsidized by the government. It's completely funded by premiums that workers pay. It keeps taxes from having to go up to pay for the Medicaid costs of the age wave. It's affordable by definition because you only pay while you're working and you only pay about 0.5% of your wages. For the typical worker, it costs about $500. For the typical worker, it costs about $300 a year, which is about $24 a paycheck. The lifetime benefit maximum is $36,500, and that goes up with inflation over time. So it'll be much higher down the road. Contributions begin in this coming January, and benefits begin in 2025. In summary, the old way or the current way we pay for long-term care doesn't work very well. It's a broken system, and that's why the Walk Cares Fund was introduced. The current way is that only about 7% of people can afford to pay for this out of pocket or to pay for private insurance. Most of us are afraid of not being able to stay in our home as we get older. People like my dad who fell down the stairs, he's panicked about having to move to a nursing home. He wants to stay in his home as long as he can, but he needs support at home in order to do so. I'm worried, many of us are worried, that as we get older, if we do need care, what is that going to mean for my spouse? What is it going to mean for my children? And most of us worry about, as we get older, if we do need care, which 7 in 10 of us will, are we going to have to burn through our life savings, not be able to leave anything to our children, and ultimately have to apply for Medicaid? The new system with the Walk Cares Fund is that for the first time in the history of this state, long-term care insurance will be affordable for everyone. We can all have peace of mind while we're in the workforce that when we're older, that if we need care, it won't devastate our spouse or our children's finances. And then we'll know that as we get older, if we do need care, our families will be able to focus on just spending time with us, enjoying those special moments that we have left, rather than worrying about how to cough up, $30,000 or $40,000 to pay for home care aid. And we will also be giving ourselves and our family members flexibility. So if you claim this benefit, you have a choice about whether you want to hire a professional to come into your home to care for you, or if you have a loved one in your life who wants to care for you, you can make a loved one a paid caregiver and pay them to provide that care, which will allow you to keep the money in the household and help pay your bills. So there's a lot of advantages to this new approach. With that, I'll pass it to Brett Kane from the Employment Security Department to talk about more about this program.
Thanks, Ben. And thanks to Representative Thai for inviting us here to talk about the program this evening. This graphic just kind of shows the path that the legislature took to get to where we are today, and then adds a couple of important dates that Ben touched on briefly. In 2019, the state legislature passed House Bill 1087, which created the program. It's a multi-agency effort. Several agencies have implementation and administrative responsibilities under the law. I'm not going to go into this here because another slide will cover that. And then the following year, as with groundbreaking new laws, a lot of times, I don't know if Ben mentioned, but we're the first state in the country to pass a law like this. So in subsequent years, a lot of times the legislature tweaks the law a bit, which they've done the last 2 sessions. In 2020, our agency, Employment Security, requested legislation which passed, and it amended some definitions under the law and also amended some provisions related to program exemptions, which we'll go over in some more detail in a minute. And then this last legislative session, House Bill 1323 passed, which made other changes to the law. Notably, it made the date by which private long-term care insurance must be purchased to November 1, 2021 to qualify for an exemption from the program. It added additional requirements for self-employed elective coverage, added elective coverage for tribes, so it created a pathway for federally recognized tribes in the state to participate in the program, and allowed individuals disabled before the age of 18 to be eligible for the benefit, which wasn't the case prior to that law being passed. And then also this year, October 1st, is when Employment Security Department will begin accepting exemption applications. And there's a 15-month window under the law that we can accept those applications. So that we can begin accepting applications October of this year through December of next year. Then, as Ben briefly mentioned, January of next year, employers begin deducting premiums from employee wages, and in January of 2025, the benefits will become available for eligible beneficiaries. Go to the minute, thank you. Ben also touched on some of this. It's just a bit of a closer look how the program works. So the trust is funded based on employee contributions. The division I work in at Employment Security, people may be familiar with the paid leave program, where there's a shared responsibility for premiums between the employee and the employer. This program, WACARES, is funded solely on employee contributions, so that's an important difference between the two programs. As we mentioned, employees will contribute starting January 1 of next year, a little over 0.5% of wages. So for a person whose annual income, as you can see on the chart there, is just over $52,000 a year, they'll contribute right around $300 for that year. So the premiums go into a dedicated trust fund that can only be used for this program. And as we also mentioned, if you have private long-term care insurance, you can either keep it and use it to supplement this benefit or apply to permanently withdraw, in which case you will not be able to join WACARES later if you discontinue that long-term care insurance. So if you apply to our agency for an exemption and you're given that exemption, you're exempted for life. You can't decide several years down the road that this benefit is something that you'd like to start paying into. Once you're exempt for life. And then, as we mentioned, those dates, we'll accept exemptions from October of this year through the end of next year. So this next one talks a little bit about what employers need to know. I'm not going to go into a lot of detail here. I think some important things on this slide that I already mentioned: workers contribute to WACARES, employers do not. The employer responsibility is they will remit the premiums to Employment Security. So they will withhold the premiums from their employees, and they'll be responsible to remit those premiums to Employment Security. And then also self-employed earners have the option to opt in to WACARES through our agency. So they're not automatically in the program unless they determine that they want to opt in. Next slide, a little bit more about how WACARES works and how you vest and become eligible for the program. So to meet vesting criteria, you must have earned your WACARES benefit by working and contributing. This first one here is the permanent pathway. So if you work 10 years at any point in your life without a break of 5 or more years, regardless of when you retire, once you hit that 10-year mark, you have vested in the program, and you can retire at 50 and need the benefit when you're 85. It will still be available for you, as long as you see on that third bullet that you work at least 500 years per those 10 years. And then there's a secondary option for those people who are maybe getting closer to retirement, and we refer to it as a more temporary vesting pathway, where if you work 3 of the 6 years from the date of application for benefits, you will be eligible for the benefit. And we get the question a lot, well, if you do that 3 of the 6 years, last 6 years, if you earn the benefit through that route, is the benefit amount the same? And the answer to that is yes. Once you are determined eligible for the benefit, you have that $36,500 lifetime benefit available. And to be eligible, you must require assistance with at least 3 activities of daily living. as determined by the Department of Social and Health Services. Last one I'm going to go over, and then I'm going to pass it off to Jeanette to wrap it up. As we've said, you can spend up to $36,500 on a combination of services and supports. This benefit is flexible, so you can choose how you want to use it. You pick the services and supports that fit your needs, the schedule, the providers. So you can hire a home care aide. As Ben mentioned, you can pay a family member, including a spouse. You can make home modifications. You can use the funds flexibly so that you can get around better, purchase a home safety evaluation so you can prevent avoidable falls, have shower bars or ramps installed, and have meals delivered to your door. And yeah, I think that's where I will stop, and I will pass it off to my colleague, Jeanette Benham.
Thank you, and thank you, Representative Thai, for inviting us today to talk about the program. I want to talk a little bit more about cross-agency responsibilities. As Ben and Brett have both mentioned, there are 4 agencies involved in, and this is a multi-agency effort. There are 4 agencies involved in the administration of this program. The Employment Security Department, the Department of Social and Health Services, the Healthcare Authority, and the State Actuary all have responsibilities in designing, developing, and implementing the program. As you can see from the slide, DSHS is the lead agency, and they'll be processing benefit applications, performing care needs assessments, and determining eligibility, and managing providers. The Employment Security Department is responsible for collecting premiums and wage reports from employers, determining vesting status. So we'll be tracking how many years individuals have paid into the program and how many hours those individuals have worked during each of those years. We'll also be processing exemption applications, and we'll process requests from self-employed individuals who elect coverage. The Healthcare Authority is responsible for paying care providers and for tracking individuals' lifetime benefit usage. And the State Actuary is responsible for providing actuarial analysis to assess the ongoing trust fund solvency. In addition, WACARES is also guided by the Long-Term Services and Supports Trust Commission and the Long-Term Services and Supports Trust Council. The commission is responsible for making recommendations to the legislature and the agencies about specific sections of the statute, and then they also can recommend changes to rules or policies to improve the operation of the program with the agencies. They also monitor agency administrative expenses, and they have an investment strategy subcommittee that provides guidance and advice to the State Investment Board on strategies for investment for the WACARES account. The Long-Term Services and Supports Trust Council determines annual adjustments to the benefit unit to assure benefit adequacy and solvency of the WACARES account. Next slide, thanks. I want to talk just a little bit about WACARES and paid leave requirements. And as you all are aware, the Paid Family and Medical Leave Program is also administered by the Employment Security Department. And since we're responsible for premium assessment and collection, the premium assessment and collection portion of the WACARES fund, we want to make the process as easy as possible for employers to report and pay premiums. So we are updating the paid leave reporting system to include WACARES. So employers will have one report for both programs. So there are many similarities between the programs. There are several sections of statute that refer directly back to the Paid Family and Medical Leave Program. In addition, the definitions for employee, employer, employment, wage, and wages are all the same for both programs, with the exception of the Social Security wage cap. There is no Social Security wage cap on premiums that are assessed for the WACARES program as there is for the paid leave program. So that's the only difference in the amount of wages that premiums are assessed on. Employers will deduct premiums, report and pay those premiums to ESD the same way for both programs. Self-employed individuals and federally recognized tribes can elect coverage for both programs, and employees covered by a collective bargaining agreement that was in existence on or before October 19th of 2017 don't have to participate unless the collective bargaining agreement has expired, been reopened, or renegotiated after that date. We've had several questions about why this date is so far in the past. And as with a lot of provisions of the WACARES law, that date was taken from the paid family and medical leave law so that both programs align, so that if employers are reporting for one program, they'll also report for the other program. And then to the extent possible, investigations for premium compliance will be the same for both programs. Next slide, thank you. I want to talk a little bit about exemptions. Exemptions, there's only one pathway for exemption to the WACARES program. Exemptions are for workers who have their own private long-term care insurance. The Employment Security Department has adopted rules that are in place that long-term care insurance must meet the definition of long-term care insurance that is already in Washington state statute. And the Employment Security Department won't be reviewing individual plans to see if an applicant's plan meets the requirement, but we do have the ability to request additional information or to audit applications if necessary. And I'll talk just a little bit more in a minute about what the application process will look like. So the individual long-term care insurance plans must be long-term care insurance plans as defined in statute. And exemptions, as mentioned previously, are permanent. If individuals are approved for an exemption through ESD, the workers won't have premiums assessed, and they'll also forfeit their right to the benefit for life. Individual workers must apply for the exemption. Employers can't apply on behalf of their employees. And this is an important point because we've had several employers who offer long-term care insurance plans as part of an employer benefit ask if they can apply for a blanket exemption for all of their employees. And that actually isn't allowed under the law. Individuals have to apply for the exemption on their own. And some individuals might choose to have both a private long-term care insurance plan and to supplement that with the WACARES benefit. And Brett mentioned this, but I want to go over it again. The key dates that are in statute for exemption applications: individuals must have a qualifying private long-term care insurance policy in place by November 1st of 2021. And then the exemption application window begins on October 1st of 2021 and extends through December 31st of 2022. And we won't have the applications available prior to October 1st of 2021. The application will be an online attestation. It'll be an online application where individuals will go online and they'll, through their SAW account, they will enter their personal identifying information, and there will be a series of questions and checkboxes and attestations that the individual will have to go through. And they'll also have to upload a copy of their approved identification. And then once they hit the submit button, the application will go to ESD staff. And I want to stress that there's a very minimum amount of processing time that will be required for these applications. The individuals are attesting that they do have their long-term care insurance in place, and we won't require a copy of the long-term care insurance policy to be downloaded with the application, but we do have the ability to randomly audit or request additional information at the time that individuals apply. And once the application is reviewed by employment security staff, the individual will receive a notice that their status has changed, and they can log back into their account to view their status. They can download a copy of their letter and their approval letter, and we will also send a hard copy approval letter in the mail to that individual. I want to go over a little bit about the employee and employer responsibilities for exemptions. And as I mentioned earlier, ESD has adopted rules that are already in effect regarding exemption. Those rules are found in Chapter 192-905 WAC, and it does outline the requirements for exemption and employee responsibilities and employer responsibilities, in addition to how individuals go about applying for the exemption. So I want to go over some of the key points that are also outlined in those rules. Employees must provide notification of exemption to all current and future employees. And this is a statutory requirement also. The only acceptable notification is a copy of the employee's approved exemption letter from ESD. Exemptions will become effective the quarter immediately following approval, and this is a requirement in statute. And all exemption letters will include the effective date of the exemption on the letter, so it's clear to both the employee and the employer when that employee's exemption is effective. Exempt employees, as mentioned previously, will be exempt for life. And employers must maintain a copy of the employee's approved exemption letter. There's no time limit put on for a minimum amount of time that employers have to keep a copy of that letter, but we're recommending that they keep a copy of that letter for at least the amount of time that the employee is employed with them. If there was an instance where then Employment Security was conducting an audit, we may ask to look at copies of employees' exemption letters as part of that audit. Employers should not collect premiums from exempt employees who have provided the approved exemption letter, and employees are not entitled to a refund of premiums that were assessed before their exemption was approved or before the approved exemption letter was provided to their employer. And I want to provide an example for this last bullet. If premium assessment begins on January 1st of 2022, and an employee doesn't apply for an exemption until April of 2022, and remember, exemption applications are accepted from October 1st of 2021 through December 31st of 2022. The employee is approved for their exemption at the end of April. Their exemption will be effective the next quarter, which is July 1st of 2022. And the employee will get an approval letter from ESD that will state their exemption is effective on July 1st of 2022. They must provide that letter to their employers. Premiums should be assessed for that employee until their exemption is effective. And then from July 1st on, premiums should not be assessed for that employee. Premiums that were assessed from January 1st of 2022 until that employee's exemption was effective are not refundable. They remain in the LTSS trust. Next slide, please. We want to thank everybody for giving us the opportunity to present today. And we have a great website that is a dual agency effort between ESD and DSHS. It's the Walk Harris Fund website at walkharrisfund.wa.gov. Information and content on that website is being updated regularly. As more information and questions come into the program, questions are updated under the Learn More tab. And there's information there on webinars that are also being offered by DSHS. If you don't find the information you're looking for, keep checking back. There's a lot of information there about each aspect of the program, from program benefits to self-employed individuals, to an employer toolkit, which has some printable information that employers can use. And there's also a spot for employers to sign up on the employer section of the webpage to receive the employer newsletter that ESD is sending out. And with that, I will go ahead and turn it back to Representative Thai. Thank you.
Thank you, Jeanette. Just listening to your presentation, I have a quick questions because of the detailed of when an employee is not being exempted from collecting by the employer of the tax. Do you have these information available in multiple languages for those who need that language assistance?
Yes, the information is available, I think, in 4 or 5 different languages on our website. And Ben, do you know how many languages it is on our website? It's 4 or 5. And we were really proud of offering that in so many different languages on the website.
Yeah, actually, I think we have a few more than that even. Yeah.
Well, thank you for that. Thank you for that. Well, and part of the reason why we are gathering today for this webinar is because our office received quite a few questions regarding this particular program, the Washington Care Fund. I'd like to share a few of those questions with the team, and hopefully we can answer some of a little more like to to the point where it particularly impact the 41st constituents. So the first question I have, I think this probably is going to end up in Todd's basket. The question is the OIC working with private insurances regarding the Washington Cares Fund?
Yes. Okay, thank you, Representative Thai, and thank you for organizing this event. By the way, your office is very organized, and just want to appreciate how that makes it go so much smoother for all of us. So good afternoon. My name is Todd Dixon. I'm the Deputy Insurance Commissioner for Commissioner Kreidler. We regulate insurance companies, agents, and brokers in our state. Now, our agency is not part of the authorizing legislation. And so you saw a slide of the 4 agencies who are involved. The Office of the Insurance Commissioner is not one of those. However, we are part, play a big role in supporting the Washington Cares program. And I want to share with you what role that is, and namely how we involve ourselves with private insurance companies. So Jeanette talked about employment security and the exemption process to be exempt from the Washington Cares program. And part of the rules state that an individual must purchase a private long-term care policy by November 1. So the question is, well, what is a private long-term care policy? And the Office of the Insurance Commissioner, we regulate what is and what is not a long-term care policy. So when Jeanette talked about applying for an exemption and attesting that you have a private long-term care, the rules state that you need to purchase a private long-term care policy that's been approved by the Office of the Insurance Commissioner. Now, to make that easier, we've done a few things on our website. So if you go to insurance.wa.gov, you'll see a list of companies that have been approved to sell private long-term care insurance products. And it's alphabetical. And what we encourage you to do is if you're interested in purchasing a plan, to take a look at that company and then call any of your neighborhood agents or brokers and ask about qualifying long-term care products. Believe me, all of the agents and brokers are aware of this program and what qualifies and what does not. I would warn you that both Brett and Ben and Jeanette said, once you apply and are approved for exemption, you're permanently excluded from the benefits of the program. So, and you can have both. You can participate in the Walk Cares and you can purchase a private plan without being exempt. But let me just share with you a little more, because we get about 300 questions a day about this. And so there's 2 kinds of long-term care insurance products that one can purchase. The first is called a traditional long-term care. It's a standalone. It's what many of us think of when we purchase long-term care insurance. These were very popular in the early 2000s. At one time, there was between 80 and 100 companies selling these, but the market really shrunk when the cost for long-term care increased. People started living longer, and premiums started becoming not as affordable. So right now, there's about 8 companies nationwide, and including Washington State, that are authorized to sell long-term care traditional insurance products. Of those 8 companies, right now, maybe 1 or 2 are still selling those products. And I'm going to tell you why it's so hard to buy a product now. Okay, so there's the original 10, now there's 8. They're still approved, but they are no longer selling them until after November 1. There's a more popular and more available approved long-term care product, and that is when you purchase from your agent or broker a life insurance policy with a long-term care rider. And I'm not an insurance broker or agent, but I can share with you, this is how it works. It's a asset-based product that it's a life insurance policy, but once you purchase the life insurance policy and you need long-term care down the road, you can receive a benefit, an advance of your life insurance policy benefit to pay for long-term care. It's important to know that not all riders qualify as long-term care. So ask the company, ask your agent, ask your broker, does this life insurance rider qualify for long-term care under the Office of the Insurance Company, Office of the Insurance Commissioner? There are about 22 companies that sell in Washington State life insurance riders with long-term care. However, and both Jeanette and Brett and Ben shared that there's a key date coming up and you must purchase a product by November 1. These products usually require underwriting. So you may need to get a physical. You're not guaranteed that a policy will be written based on your health background and all other factors. These are not guaranteed issue products. There's a process, and that process takes time. So what's happening now is more and more companies out of those 32 are no longer selling private policies because two reasons. One, they don't believe they can get all of the underwriting done and all the qualifying and get the premium in place prior to November 1. And so they're being very upfront that in this market, it's very overwhelming to be able to meet the demand, to meet all the customers that want this. And here's the second thing that companies understand is they're telling us they are not interested in selling a product for somebody just to be exempt. And I would ask you to talk to your agent or broker because they're very good at financial planning and understanding what consumers need in the long run. And so some companies have been limiting sales because they're concerned that folks will only buy these products, become exempt, and then not keep that product. And Jeanette talked about audits that are possible and follow-up. That may or may not happen, but the intent is that we want folks to keep those policies in place so they have that resource to use. So, we get a lot of questions, Representative Thai, is can insurance companies do this? And they can because they're reacting to the market condition as long as when they file how they're going to sell, as long as they suspend according to our rules, they're allowed to do that. Now they are going to start selling after November 1. So we have a list, again, at insurance.wa.gov. It's alphabetical. It's got companies that sell traditional and companies that sell riders that are very popular. And that'll give you a jump on questions you can ask your agents and brokers about selling those. And we're in contact with several companies and agents and brokers as they respond to the market. So that's just a summary of the role of our office, and encourage you to visit our website to look at those companies that are approved.
Thank you, Todd. I actually have some follow-up questions, but at the same time, I'm looking at the time. Where did the time goes? I have a few other questions that I want to get through. However, I'm going to just share with you my questions following up what you say, and maybe that is something you can provide to our office later on. When you say that insurance companies are not interested to sell their product just for the purpose of to be exempted, I'm curious why. I'm not in the business of insurance, and so I really wanted to understand from that perspective, how does it hurt the industry? Is it a philosophical conditions of why they don't want to do that, or financially it would hurt their company? Don't answer that questions. Just get back to me. I'm curious. The next question we have on the list is how was 36,500 determined to be a meaningful benefit?
I'm happy to take that one. So the approach taken was to try to have a modest, respect the role of government and society and have a modest premium and a modest benefit. This is a self-funded program from worker premiums. So if someone wanted, I mean, the legislators behind this, did research, talked to experts, talked to actuaries, did some polling, and determined that a premium of about 0.5% of wages was about what people are willing to pay. And then they asked the actuaries, well, for a premium of that level, what level of benefits would that pay for? And the actuaries came up with, said, well, about 0.5% of wages would pay for about this benefit. And that indeed is a significant benefit, and it covers most of the need from about half of the population. So 7 in 10 of us are going to need long-term care. Most of us only need it for a short period of time at the end of our lives. A small percentage of us, maybe 1 in 4, need a long period of nursing home care. And for those people, Medicaid is still there. But for most of us, we only need a year or two of care. And this program will pay for about a year of home care. If you combine that with unpaid family care, most of us have loved ones in our lives that can help some, then you might be able to stretch the benefit to 2 years to help you stay at home for 2 years. For the point of the program is to have a modest premium for a modest benefit that will make it possible for Washingtonians to stay in our homes as we get older and not have to go to a nursing home and not have a crisis for the family when we get in the situation. So when you get in the situation, you'll have money to work with to pay for home care, pay a family member, maybe combined with a little bit of unpaid family care, and hopefully that'll be all you need and you won't ever have to apply for Medicaid or go to a nursing home.
Thank you, Ben. The next question is, how will this program benefit low-wage earners in our state?
Sure, I think that's another one for me. Well, what this will do is allow, first of all, if you're a low-wage earner, you pay very little into it, right? So if you make half the median wage, if you make $25,000 a year, for example, you only owe about $12 a month into this program. So $12 a month, and in return, you get a $36,000 benefit that goes up over time significantly. And in 40 years, that benefit's probably going to be $80,000. It goes up over time up to inflation. And so what that will mean for you is that when you're older, when you need care, you won't have to apply for Medicaid. You'll have choices. You'll be able to pay a loved one, pay a son or a daughter to care for you. So you can be cared for by your family, and they can actually get money for it so that it's not sacrificing their economic security. And it means you may never have to go to a nursing home. A lot of poor people have to go to a nursing home when they're older because they don't have any other options. So this gives you dignity and independence in old age. And dignity and independence are some of the most valuable things you can have, as you get older. So I think it's really important to everyone.
Thank you so much. I was so interested in this, and so I sort of sat down and did a little bit math, arithmetic, and research myself, just sort of making some calculations regarding what 35,500 on an average, sort of like median income in Washington state. How long does it take for an individual who choose to save up in order to get that amount? It certainly exceeds the 10 years that being put in these policies. And certainly if we put in the calculations of the 58 cents per 100, this is definitely quite a benefit for individual and working families who do not make, I think in my calculation, I might be completely wrong, because this is sort of like, that's what I do in between meetings, I guess. If somebody who would make less than 250,000 a year. So this certainly is definitely a benefit for working families in my calculations. So the next question I have is, how will the state be able to pay people out for their benefit in, say, year 2025?
Sure, that's another benefits question for me. So basically we start collecting premiums in 2022, and that money goes into a trust fund, and the money comes out of the trust fund to pay benefits. So by 2025, we'll have a significant amount of money in that trust fund to start paying benefits.
Do you know how the state invests those trust fund dollars to ensure that we have enough fund to pay out?
Sure, and that's the state actuary is monitoring that, just like they monitor the pension system, they monitor that. And we also have the state investment board, which is in charge of developing an investment policy. So the state investment board will invest that money just like they do for pensions or other programs. And we're hoping that a ballot initiative will pass eventually to allow investment in equities as well, the way it is for every other similar program in the state. Last year we had a ballot initiative that was launched during a pandemic, unfortunately. And that was turned down. The ballot initiative didn't pass because I think people were nervous during a pandemic, but that'll probably come back at some point. If that passes, that will allow the state to invest in equities as well as fixed income investments. But the state actuary and the state investment board are managing the finances of the program.
Great. And I'm going to squeeze one more question in this space, is if our constituent wanted to learn more about their participations or their understanding of what the Long-Term Care Trust Commission is doing, what their conversations about, what fixes is coming down through legislations, where do they go find that information?
If they Google LTSS Trust Commission, LTSS Trust Commission in quotes, they'll find the homepage for the commission, and that they have meetings quarterly. The next meeting is September 23rd. Those are public meetings, and they can come to those meetings, watch them online, and issue public comment as well.
Thank you. Thank you. And the last question for this webinar is, can you extend the deadline? And I think I'm going to take that question actually, since the program was created by legislations, any change, and as Brett has mentioned in his slides of showing the timeline, some of the change and some of the tweak and some of the fix needed to go through legislative process for those fixes to be in place. And so the extension of the deadline, technically, it can be done during this time. By November 1st, the legislation is in the off session. We're not on sessions. The only way that we can do that is if the governor would call for special sessions and legislators could come back and debate that very question: can we extend the deadline? I wanted to share with my constituent in the 41st, personally, I deeply believe the intent of Washington Care Fund, the Long-Term Care Act, was enacted because we deeply believe in the care and providing the services available for many of us Washingtonians who experiencing many of the reasons that have been shared in the slides presented earlier in the webinar. And also, I have heard so many stories that it's really difficult for families to care for loved one without this. The long-term care insurance in the private market premium is expensive, and for people who could afford it, is one thing, but for those who couldn't afford, I'm somebody who believes in supporting and ensuring working families are being protected. And this is one way that we can actually invest and protect in ourselves. I do not support the extent of the deadline. And I believe that when we come together, putting our investment together and supporting one another when they are in need, it is the way to ensure everyone are healthy, happy, and safe. With that, once again, I want to thank all the state agency, the OIC, the ESD, and the SHS to be in this space and providing information. Once again, our office is open to any questions or concern. We will pass on your questions to respective agencies that are the expert in the area. And I thank you for taking the time. I believe this webinar is recorded. If you can find it, you can definitely search it on YouTube. I was told it should be on YouTube. And once again, thank you so much. I wish every single one of you a great evening. Stay healthy and safe.